Good afternoon. It's the 1st of March 2025. For those who are joining me for the first time, my name is Neil Davidson. I'm 54 years old. 2 years ago, I got detected with prostate cancer by a random blood test, and we've had the prostatectomy in April 23, and we've had the radiation last year. I had a whole month of radiation. And we've just had a private PSA test done today in Norwich at our hockey club by the Graham Fulford Charity Trust. The reason why I'm doing this video is I get a lot of people who ask on my comments and ask me personally what happens up to and leading to the biopsies. So I had a blood test in Latvia. It came back with a PSA of 5.6. I had a test the next day. It was also 5.6. I went to see the doctor in Latvia and they said it could be numerous of things. It could be an infection, it could be enlarged, or it could be cancer, amongst other things. So I come back to the UK. One of the first things the doctor do in the UK here, they will do a DRE, which is a digital rectal exam. 2 fingers up the back passage to see for any unevenness or anything he can feel. That was all clear. He'll then send you for a 14-day MRI referral. So I went for the MRI. It came back what they call a PIRADS 2. PIRADS 3 is level. Anything under a 3, you're unlikely to have cancer. I come back as a 2, so it was favourable for me. So after that, you get sent for the biopsies. So we went to the hospital probably about 3 weeks later, and we are talking October, November 22. And you got all gowned up, and the surgeon come in and said, Neil, I'm not that worried about it. We'll put you on active surveillance if need be, or you can have the biopsies if you want, but we're not that worried with your scores and what we've been seeing. So I said, no, we'll have it done. So basically the biopsies are, you go into the room, you sit in a chair, and your legs will sort of come up. Next to me I had a male nurse who tries to calm you down and tries to talk to you, get your mind off what's going to happen. I suppose any person's always going to be a little bit wound up, and a couple of questions he asked me, I was sort of quite sharp, not sharp with him, but a straight answer. Things like, how are you today? You know, yeah, I've been better. Whereabouts you come from? Have you come far? No. So we sort of worked out roughly we come from the same area. He lives in a town called Attleborough, which I'm about 5 miles from, and I work in Attleborough, so we had a little bit of a communication about that. Behind him was the nurse who kept all the biopsy needles. Each needle was probably 8 inches long, and I asked her how many there was, and she said there was going to be 16 biopsies. And also at the back of her was just a trainee student watching on. So the surgeon got himself ready. He will inject some lidocaine into the perineum. The perineum is a piece of skin between the male scrotum and the back passage. He injected some in there just to numb it basically. I think he then puts a grid on and he divided it into like 4 different areas to where the needles were going to go through. The most uncomfortable bit I found was he put like a 5 or 6 inch camera or something up your back passage, which he kept there all the time. I think that is obviously the camera, so that he can see where he's going in with the needles and and whereabouts he was going to take the biopsies. Did it hurt? Again, it's not like you broke your leg or something. It's uncomfortable more than hurt. Was it painful? Again, it was more just uncomfortable. I know some places will put you under a general or sedation, but where we were, and I think a lot of places in the UK, you just get on with it, and hopefully If it's too much, they just inject a bit more this lidocaine. So he asked me, was I ready? Yes, I was ready. The first one went in, and yes, it was uncomfortable. You hear a short, sharp click, and that was the first one done. They put it in a little pot, and this was going to get sent away to the pathologist or the people who do these readings. So after about 4, I'd had enough. The male nurse next to me, was just trying to keep my mind off things, and all I was just hoping for was, I didn't know it was going to be 16 at the time. I thought it was going to be 7 or 8. So once we got to number about 8 or 9, I had really had enough, and I said to him, how many more? He said, we're doing 16. So each one doesn't take too long, to be honest. Each one takes 10-20 seconds. So all in all, I was probably only in there for about 10 minutes, but that certainly seemed a lifetime. So after the 16 was done, I give you a little just to wipe up. Obviously there'd be a little bit of blood coming out of the perineum, and then you basically are finished, and then you have to go and wait in the waiting room, and you have to drink some water, and you're not allowed to leave until you have a wee, and it will be blood. It will just be pure blood that comes out. A little bit strange, never had that before, but I knew what to expect. But I went back to the waiting room, and I was a little bit white, and I couldn't really go, so I had to sit there for about half an hour. I was drinking all this water, but one of the tricks that someone told me was to go to the bathroom and turn the tap, and the tap with running water tricks the brain that you need a wee. So that's what we done. We had a wee, and yes, it was just the blood come out, and we were all set to go. So it's nothing to try and put anybody off. It is what it is. I think that it's the same wherever, in whichever country you're on. So from them 16 biopsies, I was told it would take 2 to 3 weeks to come through. I had the biopsies on the 23rd of November, and I was told the 10th of December would be my results. I then got a phone call on about the 8th or the 9th of December to tell me that the results were going to be delayed due to doctor strikes, and my results were going to be on the 29th of December. So it was a long wait. The wait was the killer, not knowing. Although I thought I'd had a good result because of the good MRI and the good DRE from the doctor. So on the 29th of December, we got a phone call. We could have done a face-to-face, but I elected to take a phone call from the hospital, and they told me that out of the 16 biopsies, that 5 of them were cancerous. The main one being a 4+3, which was right on the edge, and it led to be a positive margin. Hence one of the reasons why we had it was lucky we had the prostatectomy. I didn't know it was a positive margin then, but afterwards, once the prostate comes out, the pathology report came back, and that was the 4+3. It got downgraded to a 3+4, which means it wasn't as aggressive as a 4+3. There are more cells of 3s than there are 4s, and that's how the Gleasons worked out. Whichever number's first, like a 3+4, there are more 3s in that biopsy than 4s. So that was good news. It wasn't as aggressive, but with some 4s there, it could soon turn around as a 4+3. So where are we now? Yes, we're now nearly 2 years after the operation. Everything's going as well as can be. As I say, I had radiation last year, a whole month in April and May, and the results are coming down well. It was 0.20 when I had the radiation. It went down to 0.09. It went down to 0.07, 0.04, and that was back in October. So we've now had 4 or 5 months, and I'm hoping that today's PSA test done at the Norwich Hockey Club will be the lowest nadir point, which is 0.01. So we've got to wait a couple of days for that, and yes, hopefully the news will come back good. I'm off to Tenerife in 10 days time, so some good news before my holiday will be gratefully received. So many thanks for watching. I'm only 7 away now from 2,000 subscribers, which is absolutely fantastic achievement for myself. Never even in a million years thought I'd get anywhere near 2,000, let alone 1,000. So we're going to keep doing these little videos, these little journey videos, and I'll come back in about a week's time when I get the result of my latest PSA, and hopefully it'll be a 0.01. So many thanks for watching, and we'll see you soon.